Thank you for tuning in to another episode of Watson Clinic Health Talk. Today, we're going to discuss pediatric health, from infant feeding to back-to-school physicals and everything in between. And helping us explore this vast and varied subject is board-certified pediatrician Dr. Jason Cornett. Dr. Cornett accepts appointments from our Watson Clinic North Pediatrics location at 1430 Lakeland Hills Boulevard in Lakeland. He also rotates hours at our South location at 1033 North Parkway Frontage Road in South Lakeland behind the Oak Bridge Plaza. Watson Clinic's Pediatrics Department offers 4 convenient locations in total, which also includes our Watson Clinic Plant City and Watson Clinic Highlands facilities, and extended appointment availability for the more unpredictable and pressing concerns that every parent is bound to experience with their child. Visit watsonclinic.com/pediatrics for more information on the department, or watsonclinic.com/Cornett for additional details on Dr. Cornett. Thank you for coming in and joining us today. Thank you.
Sure.
For expectant parents, the choice of a pediatrician is a crucial one. So my first question to you is, what kind of considerations should they mull over in choosing a pediatrician? What are the qualifications you would recommend looking at?
So that's an interesting question. And I do recommend prenatal visits. I think those are very important, especially for first-time parents, because there's just so much. And the problem is now there's so much information everywhere that, not only many years ago, you got all your information from your family or your pediatrician. Now you get information from everywhere, some of that good and some of that not so good. So I think that obviously someone who has qualifications, and most pediatricians, like other physicians, are board certified and have gone through the normal regimen of training and all that. Probably some level of experience maybe sometimes is important, but I think there's plenty of excellent physicians who are fairly new or mid-levels, because training gives you quite a bit of experience. And I think sometimes there's a just general kind of fit. Mm-hmm. Sometimes when we have prenatal visits, I tell parents it's kind of like the first date. You're kind of feeling each other out, and depending on and some, honestly, I think that some parents prefer maybe someone a little younger, some prefer someone older. I think it really varies. But I think that that's a hard one too, because, there's a first impression, but you're never really going to know until you're in a situation where, when your child's first born, they've never had an illness, there's mm-hmm. never been an issue. And so, I think word of mouth is really important too. A lot of our referrals or people who come see us for the first time, it's because of a close friend or family that I've seen. And so I think that's sometimes a big one. But I think that in pediatrics, more than any other profession, trust is a big deal. You have to trust us because it's an honor for us to be, as physicians and pediatricians, parents are really giving us the honor and trusting the health of their child in our hands, and trusting our advice and trust, the things that we say and our guidance. So you kind of have to build that from the start. So sure. I think first impressions are really important. And so that's probably my favorite visit. I've been doing this for 25 years. My favorite visit of any of the visits is the first time parent who's fresh from the nursery, the baby maybe 2 or 3 days old, and the parents are exhausted and they're a hot mess and they're scared to death. And you go in and, you try to really relay their fears and certainly kind of lighten the mood. And then that progression from the first visit until maybe the 1 week or two, the learning curve is huge. Mm. And when they come in, they're like, oh my gosh, they don't look panicked. And wow, you get a lot of positive reinforcement. You guys got this, and then it just grows from there. That's probably one of the more rewarding things we do. So
how soon after birth do you schedule that first appointment?
So typically after the hospital discharge, depending on the situation, usually the baby's between 2 and 4 days of age. Now that can vary. If there's any issues in the hospital, there's concerns about baby's weight gain, if jaundice concerns, anything like that. It could be earlier, but typically it's 2 to 3 days of age. And then the next follow-up is always depending, and if it's a first-time parent, and let's say it's a mom who's nursing, it's a little bit unfair sometimes the first visit because nothing really happens until maybe several days out. And so, they've just got out of the hospital, poked and prodded, and then we see them a few days later. And sometimes that's good because you don't want to miss anything, but you're not really giving the family a chance to kind of like get their sea legs. Yeah. So sometimes it's important, but, I try my best to, after that, if I can, leave them alone unless they need me. But obviously there's variables to that. If there's concerns about weight gain, especially a mom who's trying to nurse and in the beginning, it takes some time and the babies lose weight. So you always want to recheck that. And if there's any other, potential issues. So,
there are, I would imagine, well, I know you have to oversee kind of the developmental milestones and make sure that the child is on track with those. What are some of those milestones?
So we see them a lot in the first 2 years. So typically after the first visit, and if there's no in between, then we see them at 2 weeks. And in the beginning, development, there's not a lot. You're more just kind of feeding and growing. Really not until between 2 and 4 months are you monitoring things. And those could be early. It's just, vocalizations and smile and motor wise at some point between 4 and 6 months. Are they rolling over? And then eventually are they sitting up? Speech starts just vocalization and babbling. And then, saying the first word or mama dada, that may not be specifically for mama dada, but starting to jargon and things like that. And then when are they walking? And there's windows for this. And so not every child meets every milestone at the same time. And so some kids are early walkers, some kids are late talkers. So it varies. So, but that's why between birth and really a year and a half, you're seeing them literally every 2 or 3 months to kind of monitor those things. Then you start to spread it out unless there's concerns. Because then, after a year and a half, you don't see them again until 2, and then it's just once a year. So much to the delight of the kid who at that age hates our guts. So they never come in. Those visits are never good. They're either sick or they, may get a vaccine or something. So it's not and a lot of stranger danger and whatnot. So we're not their best friend. We eventually, they like us, but again, it's like the 6-month visit. They're very friendly. They like everybody. And then it's kind of like, okay, you're going to hate me for the next year and a half, but they come around. So.
If a baby is frequently fussy or crying, is it a common concern for new parents? They're not sure if they need medical attention, if they should schedule an appointment.
Yeah. So that's a good one. There's kind of normal baby fussiness, and then there's like, okay, something's not right fussiness. And no matter what the issue is, whether it's that or something else, first-time parents are you're just not going to know necessarily. And so, we always encourage parents, and that's why I think we have very good availability for things like this same day, after hours, we're always available if there's concerns about that. I have 3 kids and 2 of them had colic. So speaking of fussy, they just cried nonstop. I'm a pediatrician. I've done this for a very long time, and they threw me for a loop where I was like, am I going crazy here? Is there something wrong with them? So, I can imagine a family who doesn't have any, necessarily medical expertise. And so I tend to, in a lot of those instances, I think moms, even if they're first-time parent or dad, I keep saying mom, but dad too, I think parents' intuition is really important. If a parent calls and they're giving me all the right answers, but the mom's like, I don't know, something's just not right. I think that's really important. I think you have to take their word for that little spidey sense, because more times than not, they're right. Now, that may not be something terrible, but I think that moms and dads sometimes, typically more moms, have a sixth sense sometimes about those kind of things. And so, especially once you've done it, parents of multiple kids and whatnot, you tend to like pick up on things. And so
I totally agree.
100%.
Are you ready for a lightning round of questions?
Oh no. Let's do it.
How many hours should a baby sleep?
Well, that depends on the baby. And see, that's an example of things that really depends on their age, because a baby who's a newborn, pretty much they're gonna eat and then be back to sleep, and they're gonna sleep 20 plus hours a day. That starts to space out, where after a few weeks or months, they're up every 2 to 4 hours eating, and they may have a little bit more awake time, but still sleeping a lot. Now, somewhere between, some parents get lucky and it's earlier than 6 months. Sometimes it's later, but at some point between maybe sometime 6+ months, babies hopefully are sleeping a good stretch at night, maybe 6 hours. It doesn't always happen like that. My kids never slept well ever. So, and that's a tough one, because sleep, sometimes it's truly other things can cause that. Is it at some point, I tell parents about sleeping, like at some point, late infants and young toddlers turn into expert sleep trainers. They know how to train their parents, not the other way around, meaning that they know how to get you up whenever they want. And so that's a tough one, where a little bit of tough love without, too much tough love sometimes is a tricky one, where, okay, is my child up tonight, overnight, because something's going on? Are they really hungry, or just do they want me? And so, those kind of things are tough. So.
Breastfeeding versus bottle feeding.
Well, so that's a tough one, because obviously what I'm supposed to say is breastfeeding. And yes, in a perfect world, we're going to encourage breastfeeding as much as we can. But there's nuance to that, because it doesn't always happen in some situations. So it's really hard for me if I just say, I definitely always recommend breastfeeding, which, yes, Academy of Pediatrics is going to recommend it. We're all going to recommend breastfeeding. We're going to try to encourage that as much as possible. But there's something I call breastfeeding guilt that a lot of moms will have, and my wife certainly had it, and I see it all the time, where it's this overwhelming defeat if you don't do it, and so, and listen, I'm a man, I've never breastfed, I'll never breastfeed, and so I'll never have that overwhelming, not only intestinal fortitude to do everything I can to try to do it, which is pretty incredible, that you'll see the desire and want to do it and go to so many lengths, lose way too much sleep, and the struggles of trying to do it. And I always try to encourage it, but I never want, I guess what I'm trying to say is, I never want it to be the feeling that it's defeat or less than if you have to, you can't do it. And so, and most parents and most moms, if somehow either the baby's not gaining enough weight, or there's some difficulty with nursing, perhaps not producing enough, or there's some issues, most are totally fine with, whether it's just giving some breast milk, some formula versus breast milk. So what I would say is this: you can grow a baby multiple ways, so whether it's breast milk or formula. And so, yes, we are going to encourage breastfeeding. There are obviously multiple benefits from that. Probably the biggest is the immune components that babies get very early regarding, their immune system, which is somewhat immunocompromised early. But Formula is just fine. And, every year, every decade, they're making more and more advances, trying to get it as close as they can to breast milk. So I'm never going to discourage one or the other. So let's say a family comes in and they're, listen, we decide we just don't want to do breastfeeding. We just want to do formula. Fine. I'm not going to try to sway someone one way or the other. Again, you can grow a baby multiple ways.
Yeah. So typically at what stage or age should a child switch to solid food?
So typically somewhere between 4 to 6 months. And again, that's very dependent on the baby because there are some kind of milestones, head and neck control, this kind of natural reflex they have, this protrusion reflex to spit, kind of a protective thing to spit food out, their interest in food. So developmentally, somewhere between 4 and 6 months, they may be ready. Now, again, that really depends because, for example, the recommendation is that if they are just on breast milk, they may need more, those babies may need more iron, and that's where some of the iron fortified foods come in, like the cereals and things like that. So by 6 months, you want to be maybe encouraging those to get more iron in. When it comes to other foods, purees and things like that, some babies are ready at 4 to 5 months, and some are maybe not be ready till later. Some parents just don't want to deal with it until 6 months, which is fine. Some babies may have history of maybe some allergies, like a milk allergy or something where, they've had some issues or maybe reflux or something. So maybe it's better to wait. Babies who may be premature, maybe their GI system's not really ready for food this early. So you may wait till 6, not give it early. But it's interesting. Food, the recommendations about food have changed over decade. It's like the whole, okay, you sleep on the belly, now you sleep on the back. Babies, they would encourage sleeping on the belly because of concerns about reflux and aspiration. Well, they realized that the risk of infant SIDS and crib death was higher, so now we're sleeping on back, and that incidence went down by 50%.
Wow.
What we learned in later childhood, not infancy per se, but certainly before 1, we used to kind of discourage, not too early feeding, and especially some of the more allergenic foods, eggs, peanut butter, things like that. Well, that probably caused more issues. Delaying allergenic foods probably increased the incidence of food allergies. And so there was a study, I believe it was in Israel, where those families were giving their children, way before 1, these snacks that had peanuts in it. So they were exposed to those foods very early. Their incidence of peanut allergy was significantly lower than ours. So delaying those foods probably, encouraged or may have induced more allergies. So that's an example where we're not discouraging those things early, meaning that not after 1. It used to be, we'd be like, oh, don't give those until after a year of age. We're not doing that anymore. And feeding too, just really, again, that's the thing, is it so varies in the child. Some kids take to feeding very early. Some it takes a little bit longer, their oromotor skills. And so they all most of the time end up at the same place, but it varies. And again, also with whether it's a first, second, third child, sometimes they may be more anxious or less anxious to start food early or not. So,
when should you start to worry about a fever?
Fever is very variable. So that's one that at the newborn visit that we talk about and stress, because fever in the first really couple of months is basically an emergency, especially the first month. Any newborn or infant in the first really month and sometimes 2 months who has a fever is going to be put back in the hospital and have multiple tests run, including a spinal tap and blood and all this stuff. And they'll be in the hospital for 2 days because, and this is why we don't do vaccines really until 2 months, basically their immune system is not great, and we assume it's kind of immunocompromised the first couple of months. And so you have to kind of assume the worst, and it's usually not the worst, but any fever, you have to assume this could be something bad, meningitis or things like that, which luckily, because of vaccination, we don't see much anymore, but it's possible. So as they get older, we treat fever very, very differently. And I tell my families this, like, when they're older and you call panic about fever, I'm going to say, relax. Fever is usually a good thing. Our body is generating a fever to get rid of something in our body that we don't want. So, but you have to look at the big picture. So it's really dependent on age. It's depending on what else is going on with the child. Are they lethargic? Are they eating or drinking? Are they inconsolable, puking and then can't stop, vomiting? There's a lot of variables for that. And the older the child, the more leeway we kind of give to that. And then it really depends on length of time of the fever. Like a few days and it goes away, that's fine. A fever that continues, okay, then you got to start looking for things. So
let's talk vaccinations.
Let's do it. How many hours you got?
I know. So what are the vaccinations that are needed in infancy and onward that you provide?
So if you want to get specifics, and this is a good question, and I'll get on a little bit of soapbox without getting too controversial. So I'm going to answer a question that you didn't ask, but why the ones that we give and why so early the ones that we do give? Well, the first potential vaccine kids get, and this is really important because this is not communicated very well, they may get a hepatitis B vaccine in the hospital, okay? And so, and the perception is that, we're just trying to give a vaccine early, and that is definitely not what that is. The hepatitis B vaccine given in the hospital, it's basically recommended for every infant in the first 12 hours of life. And the reason that is that rarely, some moms may not know their hepatitis B status, may not have prenatal care, rarely could have contracted hepatitis B during pregnancy. Obviously, this is rare in most instances, but it does happen. If that's the case, heaven forbid mom has hepatitis B, she can vertically transmit that to her child. If you give the Hep B vaccine to the baby in the first 12 hours, you can block that transmission. So that's why we do that vaccine. Otherwise, the first set of vaccines are going to be at 2 months of age. And there's several. We do a Hep B also then. Polio, we do the immunization for polio. What's called DTaP, which is diphtheria, which is a respiratory infection that we haven't seen in a long time because of vaccination.
Because you've been vaccinated.
Tetanus and pertussis, which is whooping cough. I always tell parents, go YouTube an infant who has whooping cough. It's frightening. And then we do two separate vaccines for bacteria. One is called Prevnar or for strep pneumo or strep pneumococcus, and then another vaccine for a bacteria called Haemophilus, or we call H-flu. Those two bacteria, and this is really important because, like even me, I've been doing this for a while, but I've not seen measles in my life. I've never diagnosed polio. I haven't seen smallpox, but strep pneumo and Haemophilus were bacteria that used to cause a lot of damage in little kids. Meningitis, leading to brain death, leading to deafness. Once or twice a week, a young kid would come into our office who had a high fever and maybe have one of those diseases that you had to check for. So those have been pretty crucial in preventing a lot of morbidity and mortality in little kids. And then the third one, or the last one we do at that age, is an oral vaccine called for rotavirus. And I always tell parents, although I'm old enough now that a lot of my parents have had this vaccine, but you and I never had it. I always tell them, if you ever had a stomach bug and you thought you wanted to die from puking, it was probably rotavirus. Rotavirus is a virus that causes a gastroenteritis or vomiting and diarrhea. That in this country, obviously, there wasn't a lot of death in the world. I think it used to be 500,000 deaths, but in this country, tens of thousands of kids would be hospitalized. And trust me, in my training, I admitted, took care of tons of kids, as a lot of my colleagues did, because that disease, pretty much you would present with fever and puking and diarrhea and really, really sick. And there's nothing you could do but just put an IV in the kids and hydrate them. So now, never see it. I can't tell you the last time I've put a kid in the hospital for rotavirus. It's been maybe decades. I don't know. So those are at 2 months of age. And then there's boosters for those at the 4 and 6 month visits. And then, starting at a year, there's other vaccines, the measles, the MMR, chickenpox, things like that.
But you bring up measles, and we're seeing measles outbreaks.
Yeah.
From lack of vaccination. Something that we haven't dealt with in forever.
No, we had eradicated it. I think in the 90s at some point we had eradicated measles. And so, again, that's one of those things where you look at mortality versus morbidity, and some of these things maybe, and yes, measles, there was a mortality, kids died, people died from measles, but it's not just the mortality, it's the morbidity. And I could say the same for rotavirus. Like some people got pretty sick, hospitalized, pneumonia, things like that. And the problem with measles, and it's even more now than when measles was, such a thing in the, it was kind of a rite of passage in the 40s, 50s, 60s, whatever. The world is a very small place now with international travel and things like that. And so measles is so contagious. For example, what's called the row, the R row number is basically how contagious it is. And basically, if I have an infection, how many people can I infect? Things like flu and COVID, I think the row is like 2 to 4. So I could technically, in my sphere, infect 2 to 4 people. I think the row of measles is like 14 to 16.
Oof.
So basically, if I have measles and then I leave this room, it's aerosolized, it's respiratory spread. This room is contagious for like 2 hours. That's how contagious. So it's such a contagious, I think it's the most contagious disease we have. So that's the problem. You put that on top of air travel and everything, it just makes it very, very complicated. So hopefully, the good news is, despite all the questions we get about vaccines, I do have parents come in asking, how early can I get them? Because they're concerned about it. And, luckily we haven't seen any, in our office or anything like that. But there is the concern, are we going to recognize it? Because we got rid of it. I've never seen it. That's the thing, is that these diseases are invisible, but they're not that, they're invisible because, you read about them in books or hear things about them as if they didn't exist. But just in the 80s and 90s were some of these things very prevalent. And so they're only a plane ride or, some other travel away. So,
well, I wanted to go on another track here. You were earlier talking about some research and how it's changed understanding of pediatrics over the years. You've been practicing at Watson Clinic since 2004, yes. I believe. And just in that time, I would think one of the great profound changes has been cell phone usage, screen time.
Yeah.
Is that a big concern for young kids?
Yes. And I have 3 teenagers, so I'm obviously in that struggle right now. And so I think for lack of, at the risk of being simplistic, the dopamine fix that we all get from cell phone screen time is a problem, is a problem. I think that I'm not sure if I could recite any, I'm sure it's out there as far as specifics or details or whatnot. The earlier these kids are on these, what's happening to their fine motor skills and their frontal cortex as far as their ability to be creative and task and things like that. And I say we because, and this is what I tell my kids, my own kids. I'm like, listen, we're all, they make them that way that, you get that text, that scroll, whatever, and it's a fix. It's a dopamine hit, and then so you want, it's not enough. So
doesn't it also? It seems like it also inhibits socialization.
Yeah. No.
That's a major developmental factor to worry about. Your ability to socialize with others.
100%. And I think that when you already have these and the prevalence of kids using them younger, And then you put on a pandemic where we just shut the world down,
Yeah.
and then we're all in our houses and, remote learning and stuff like that. And so, I've found it even in my own kids sometimes, they communicate better through text with me than actually, they'll be more verbal. And so I don't know if that's a good or bad thing, but I think that person-to-person contact and interaction and conversation, because you can't see physical cues, the social cues, things like that. You can't see that on a phone. I think that's really important.
Yeah.
And so I think we're losing that. I agree.
Well, this podcast will post in July. That's when we're recording it as well. And so kids will be gearing up to go back to school soon. What kind of appointments should they make for their back to school health?
Yeah, so this time of year, we're very busy with kind of back to school and school physicals. Now, we want to see kids once a year for just a yearly check-in. And some kids are very healthy and it's an uneventful visit. And then some maybe have medical issues that we have to follow up on, allergies, asthma, ADHD, something like that. This is something that I like to stress, is that this whole quote unquote sports physical versus we don't really, because for school athletics and things, they require a sports physical to be medically cleared to play, sports. We just want to see kids once a year, and we do a comprehensive physical, which is everything. We clear them, we screen for any risk of any possible cardiac issues or something that would preclude any sports participation. We go over their, chronic illnesses. Do they need vaccines? Do they need to talk about vaccines? Older teens screen for depression and anxiety. All monitor their growth, all those things. It's a lot. And so sometimes what I find is parents will just last minute go somewhere just to get a quick, sports physical. You're not getting all that. And so that's why we really want to see them in the office, because we know them. And sometimes it's a quick, yes, you're fine. We'll fill out your forms. But sometimes you pick things up that you wouldn't normally if you're just seeing them every few years. And so yeah, we're very busy this time of year with that.
Yeah, but a comprehensive physical, you get a clean bill of health for every aspect of what a physical entails, and you'll also get the approval for the sports.
Yes, you get
physical.
a BOGO.
Yeah.
BOGO, yes.
No, that's good. That's good to know. My last question for you: what's the best part about what you do?
Oh, I'll tell you what's great right now is now I'm on second generation. So I'm seeing kids of kids. So some of my moms and some dads who I saw maybe in middle school or high school when I started here, I'm seeing their kids now.
Wow. Yeah.
That's probably one of my favorite, because I feel like I'm not old enough to be a grandfather, but I'm kind of like, it kind of feels like it. And those moms are so loyal to me. I love it. They're just so sweet. So I really like that a lot. And I really do like the young families, just to see the progression and really just pediatrics in general. It's a lot of touchy-feely, yes, but it is just you really are treating a family. You're growing with a family. Again, I'm seeing, second generation now. I've been, at the Watson Clinic 21 years, so my newborns are now graduating college. That's a crazy thing. And so that's probably the coolest part of it. And I think in general, pediatrics is such an optimistic field. Kids they're on the upswing of life, not the opposite. And so I think that's what keeps us coming every day. So
thank you so much for coming in. This was a
great.
pleasure.
No, I had a great time. So thank you.
Thanks again for tuning in to Watson Clinic Health Talk. For more information on Watson Clinic's Pediatrics Department, visit watsonclinic.com/pediatrics. And to schedule an appointment with Dr. Cornett specifically, call 863-680-7337 or visit watsonclinic.com/Cornett. Be sure to subscribe to our show and leave us a positive review wherever you get your podcasts if you enjoyed this episode. Till next time.